Hello everyone. I want again to welcome all of you to this new lesson. Remember in the last lesson we talked about an introduction to types of interpreters, of course professional interpreters. And in this lesson we are going to focus on the first one, that is medical interpreters. We want to know who are the medical interpreters. So we say in a healthcare setting, it's extremely, of course, important to have a clear communication between the physicians, the doctors, the clinicians, and of course the patients who are hard of hearing. We need clear communication. So for that case, we need an interpreter to facilitate communication between the physicians and the patients who are of course hard of hearing. So medical interpreting or interpretation provides that communication between the patients and their doctors, nurses, or other staff in the medical field ensure that medical providers understand the patient's symptoms for, of course, accurate diagnosis. So you have to be able to understand what type of symptoms is the patient talking about so that we are able to give proper guidance. So doctors need to know all this information. So as well as to ensure that patients understand their treatment plans. So not only we facilitate interpretation during a medical interpretation to ensure that doctors get to understand the symptoms and signs coming from the patient so that they give appropriate diagnosis, but also for the patient to understand treatment plan so that to avoid unnecessary accidents or taking wrong information. So the quality medical interpreting requirements, of course, intimate knowledge, requires intimate knowledge of medical terminology. Don't go to interpret in a hospital if you are not a medic, or if you are an interpreter who have never heard about medical terms. Don't go there. You are going to look for embarrassment. Embarrassment, you'll get it. You are going to mess up with the patient and the doctors. So don't. You can cause someone to die because of your ignorance. So don't go there to interpret in a medical field if you are ignorant or you don't know what it means by being a medical staff or anything to do with medics. So don't. I've seen so many people or interpreters, of course, those careless interpreters, so many of them. Someone knows only how to sign ABCD, father, mother, and what have you, and runs to a hospital to go and interpret. You're going to mess up. Don't. We are not learning sign language so that we look for opportunities even in the events that we don't have an idea. That's not the major reason why we are learning sign language. We learn sign language to facilitate and ease communication in a clear way. For this case, if you don't get the language, don't use it. Don't use it in a situation that you don't understand. You better use sign language for general communication for interaction, but not for specified events like now in the hospital. So don't go there to interpret if you don't know medical terminology. That's very important that we as interpreters, we have to understand. So an understanding of cultural differences is also necessary in a medical event. So get to know what it means by a cultural, the cultural setup, meaning what are some of the customs, norms of a given patient. So get to know these things understand them fully, so that you link the doctors or the physicians with the patient who is hard of hearing appropriately. I have witnessed one event whereby one interpreter, the one I've just talked about, that someone goes to an event that he or she does not understand. We have had a scenario in the past where an interpreter who don't understand the court language went there, interpreted, gave wrong interpretation during a court process, and the deaf person, who was of course the accused, was sentenced to life imprisonment because of careless interpretation. So don't go there to mess, don't go to the hospital to mess up the doctors and the patient if you don't know the medical terminology. Remain a sign language user than specializing yourself, claiming that you are a professional sign language interpreter when you don't understand different types of events. Brothers and sisters, let us have that passion to be able to help the community, not to ruin the community. As we get on, we'll be able to understand each of us. We'll know who we are, so that we are able to only engage in the services that we are professionally perfect, to avoid embarrassment. See you in the next lesson.